Vaccination coverage is an important piece of data that can be used to monitor vaccination program and estimate the public health impact. In this work, we will estimate the misclassification of yellow fever vaccination status, and we also observe the effect of this uh, the misclassification on the disease burden estimate. On our method, we define three possible states of the person M. Either he or she will be infected, or reportedly vaccinated, or truly vaccinated or not. And we can construct the likelihood of our dataset, which report the vaccination and infection status for every individual M. Um, that can be dependent on the sensitivity and the specificity of classifying the vaccination status. We then derive the estimation based on this likelihood and use that to offset the bias in the vaccination coverage data. This set of adjust coverage, but then implement to generate the burden of the disease based on a model that we already established in our previous work. First, conduct a simulation study when we simulate 100 dataset reporting vaccination and infection status based on 100 predefined value of sensitivity and specificity. As we can see on figure 1, the estimated value and the true value match pretty well, proving that our framework is working. We then conduct the estimates on the real data by implementing this framework on the WHO yellow fever surveillance database. And we estimate that the sensitivity and specificity of the vaccination status is not 100%, which is not perfect. So there can be a substantial misclassification of vaccine status for diseases as yellow fever. And we derive the modified vaccination coverage as we can see on figure 2. And we base on this estimate to generate the burden. So the next panel, we can observe how the disease burden estimates each change. We can see that the death averted, the uncertainty around the death averted reduce when the misclassification is included. So we come to our conclusion that there may be substantial misclassification of vaccine status for diseases as yellow fever, and this misclassification significantly entered the estimation of yellow fever disease burden.